Psychoanalysis was founded by Sigmund Freud. Freud believed that people could be cured by making their unconscious thoughts into consciousness and motivations, thus gaining an insight. The aim of psychoanalysis therapy is to release the repressed emotions and experiences of the person, that is, make the unconscious as conscious. It is like only having a cathartic, which means healing experiences, and the person can be helped and cured. Now let us talk about the basic assumptions of psychoanalysis. Psychoanalytic psychologists believe that psychological problems are rooted in the unconscious mind. Manifest symptoms are cured by hidden disturbances. Typical causes include the unresolved issues during development or repressed trauma. Treatment focuses on bringing the repressed conflict to consciousness where the client can deal with it. Psychoanalysis is a therapy as well as theory. Psychoanalysis is commonly used to treat depression and also anxiety disorders. In psychoanalysis or therapy, Freud would have a patient lie on a couch to relax, and he would sit behind them taking notes what they were describing him about their dreams and childhood memories. Psychoanalysis would be a lengthy process which usually involves many sessions with the respective psychoanalyst. Due to the nature of defense mechanisms and the inaccessibility of the deterministic forces operating in the unconscious, psychoanalysis is in its classic forms is a lengthy process involving 2 to 5 sessions per week for several years. This approach assumes that the reduction of symptoms done is relatively inconsequential, as if the underlying conflict is not resolved, more neurotic symptoms will imply substituted for the person undergoing psychoanalysis. The analyst is typically a blank screen disclosing very little about themselves in order that the client can use the space in relationship to work in their unconscious without interference from the outside environment. The psychoanalyst uses various techniques as encouragement to the client to develop insights into their behavior and meanings of symptoms, including ink blots, parapraxis, free association, interpretation including dream analysis, resistant analysis, and transference analysis. Rorschach ink blots. Due to the nature of defense mechanisms and the inaccessibility of the deterministic forces which are operating in the unconscious mind of a person, the ink blot itself doesn't mean anything as it's unclear. It is what you read into that it is important. Different people will see different things depending on what unconscious connections they make. The ink blot is a projective test as the patient projects information from their unconscious mind to interpret the ink blot. However, behavior psychologists such as B.F. Skinner have criticized this method as being subjective and also unscientific. What are Freudian slips? Unconscious thoughts and feelings can transfer to the conscious mind in the form of parapraxis, popularly known as Freudian slips or slips of tongue. We reveal what is really in our mind or by saying something we didn't mean to, or unintentionally we say that. For example, a nutritionist giving a lecture intended to say that we all demand the best of bread, but instead he said bed. Another example where a person may call a friend's new partner by the name of the previous one whom we liked better. Freud believed that slips of tongue provided an insight for the unconscious mind into their conscious mind, and that there were no conflicts. Every behavior including slips of tongue was significant, that is, the behavior is determined. Free association. A simple technique of psychodynamic therapy is free association, in which a patient talks of whatever comes into their mind. This technique involves a therapist reading a list of words and the patient immediately responds with the first word that comes into their mind. It is hoped that fragments of repressed members will come into their Course of free association. Free association may not provide to the best it usually promises, but on the other hand, the presence of resistance often provides a strong clue that the client is getting close to some important repressed idea in his thinking and that further probably therapist is called for. Freud reported that his free associate patients occasionally experiences such emotional symptoms and it is called as flashbacks. Such a stressful memory so real it feels like happening again and again to the patients. If a such disturbing memory occurred in therapy or with a supportive friend and one feels better, relieved or cleansed, intentionally emotional experiences would be felt by the patient and provided Freud a valuable insight to the patient problems. Dream analysis. According to Freud, the analysis of dreams is the royal road to unconstitutable argued that the conscious mind is like a sensor, but it is less vigilant when we surface through the mind. As a result, repressed ideas come to the surface through what we remember or what may well have been altered during the dream process. As a result, we need to distinguish between the manifest content and latent content of a dream. The forms is well what we actually remember and the later is what we really mean. Freud believed that very often the real meaning of dream had sexual significance and in his theory of sexual symbolism, he speculates on the underlying meaning of the common dream memes. Psychological therapies involve exploring psychological difficulties that are getting in the way how we would like to feel. There are different types of psychological therapies which are more suitable for certain problems. Therapies can be one-to-one or with other members of the family, like in a group of people with similar problems. Therapy may be mainly concerned with what is happening in your day-to-day life or about understanding the connection between the past and present to make our lives better. Some therapies may be relatively brief, usually like 8 to 10 sessions long, but others may involve working together for longer period of time, which depends on the service a person accesses, and this will be discussed with the therapist early in the therapy. Psychological therapies are more likely to work if you feel comfortable and ease with your psychologist, therapist, or counselor or a group leader. Finding the right person for you is important as important as the type of therapy you're choosing. Art therapies are an in-depth making use of the art alongside talking to help to make sense of difficult past and present experiences. No experience in life using the arts is necessary to benefit from these interventions. Only a willingness to explore using creativity as part of the therapy process in the arts therapy. Cognitive behavioral therapy. This is an umbrella term which includes a number of therapies that look at way thoughts and feelings and behaviors interact with each other. They are used to identify and change unhelpful patterns of thinking or behavior which may have their roots in the past experiences of the person. Types of CBT. Rational emptive behavior therapy. This involves identifying irrational skills of a person and beliefs and finally learning to recognize and change these patterns. Next, cognitive therapy. This therapy mainly centers on identifying and changing inaccurate or distorted thinking patterns of the person, emotional responses and behavior. Next one, multimodal therapy. This therapy suggests that psychological issues must be treated by addressing 7 different but interconnected modalities which are behavior, affect, sensation, imaginary, cognition, interpersonal factors, and drug या biological consideration. Next one, dialectical behavior therapies. DBT. This addresses thoughts and behaviors while incorporating strategies as emotional regulation and mindfulness. Cognitive behavioral therapy is mostly affordable for most people. Family and couples therapy can help those people who are in close relationships to better understand and support each other. It enables family members to express and explore difficult thoughts and emotions safely, understand each other's experiences and views, appreciate each other's needs, build on family strength, and work together to make useful changes in their relationship to last their lives and relationship longer. Family and couples therapy can be delivered using a variety of therapies types, which include cognitive behavioral therapy and dialectical behavioral therapy, depending on the therapeutic technique that has been deemed as the most approved for your individual mental health concerns, as well as the unique dynamics within the family and personal relationships between each other. Group therapies can follow a range of different approaches. However, what they have in common is that they take advantage of shared experiences and relationships that can arise in a group. The principles of group therapy are the installation or giving hope to the person. Universality means making the person feel that they are not alone. Sharing information with each other in group, which is known as altruism. The corrective recapitulation of primary family group in which childhood experiences are explored, development of many socialization techniques, initiative behavior, interpersonal learning, group cohesiveness, catharsis, external factors. Group therapy can be effective to treat depression. Individual formulation based psychological therapy. This is a personalized therapeutic approach based on in-depth understanding of individuals' problems. Relational therapies. Relational therapies is an umbrella term for a number of therapies such as cognitive behavioral therapy, psychodynamic psychotherapy, interpersonal therapy, and mentalization based on therapy. These therapies support individuals to think about their current difficulties in the context of past and present relationships with others and with themselves, and to consider how this might affect the possibilities to change in their lives. Trauma focused therapies focus on ongoing effects of past trauma and include eye movement desensitization reprocessing EMDR. The arts therapies can also be trauma focused depending on the needs of the individual. It is a specific approach to therapy that recognizes and emphasizes understanding how the traumatic experience impacts a child's mental ability, behavioral, emotional, physical, and spiritual well-being. The 5 P's in mental health are identifying, presenting risks, predisposing, precipitating, perpetuation, and protective factors, and developing a narrative to describe factors likely to increase and these factors to decrease risk. You can expect to be treated with dignity and respect, to be told what choices of therapy are available, to be given information so that you understand what the therapy involves, to be seen by a sustainably trained therapist who will work to a professional code of conduct and who will be receiving supervision of their work. You may be offered at first a meeting for assessment to help decide which therapy might best suit you and which therapy is most likely to be effective. At the start of your psychological therapy, you can also expect to discuss your therapy contact, which will include agreeing to the main focus of your therapy, how many sessions will be offered, and what is the cost of the therapy. At the end of the contact period, there will be an opportunity to review the contact or the progress made during the therapy session. Your therapist will make written case notes about your sessions in your electronic file. This summary of each session can be read by other mental health professionals involved in your case, such as your care coordinator. All written notes about your are kept secretly and confidentially within the group members. If any question arises about your confidentiality, you need to discuss it with the therapist and the group members. Sometimes engaging in a psychological therapy can make you feel a little worse in the short term, but this is a natural reaction and usually part of the therapy and recovery process. If you experience this, you have to talk to your therapist and utilize the support and discuss with the therapist. Having therapy can also affect you and your relationships with your friend and family in a negative way as well as positive way. So feelings may come up in the therapy and may you feel vulnerable and angry. It is not usual to feel worse before you feel better. It is the therapist's job to work with you to understand the feelings of you and help address them as they are. If you feel like your therapy is working for you, it is best to talk with the therapist and they will help you to continue.